2 years ago, Anna Liffey asked me to host an event in the AV room because they wanted to present their position on the medically supervised injecting centres. And they came in there and they showed the film from Australia of one of these injecting rooms. And being honest about it, it was very difficult to watch people injecting themselves. And it was obvious from the film, it was a very particular client group. They were long-term users of heroin who, for various reasons, had not stopped taking heroin. The heroin addicts in the film, they were an older cohort, they were articulate, and their drug use was such that they were able to wait to come to the rooms to inject. So I have a particular concern that some of our injecting heroin users, their lives are very chaotic, probably due to polydrug use with alcohol, and I have a concern, about their inability or ability to wait to get to an injection room to use the facility there. But I would say that the projects and the outreach workers, they will know the client base who can avail of the rooms. It was obvious from the film the level of staff training that was available. And it was also obvious the other services that were there. And I think that's the part that we have to get right here. I've spoken with people who have visited these rooms, others who have worked there, and I know yourselves, Minister, you're in Copenhagen. And what I've been told is that because the other services were available, the addict was in a space where he or she could be engaged with, and that there were some who were able to address their drug use, and counsellors there saw a reduction in usage and some being supported into recovery. Because I think we should never lose sight of recovery. And all supports have to be available to encourage people into recovery. And I want to mention the Recovery Academy, which is based in Silesha. And Silesha and other projects have been supporting the recovery journey. And their payback, apart from the benefit to the person in addiction's lives, there's also the payback in their communities and economically as well on the health services in this country. And they themselves are paying back by becoming recovery coaches and enabling and facilitating and supporting others into recovery. And they have really good models in England and Scotland of these recovery academies, organising recovery cafes, recovery business centres, where people who were in addiction and in recovery now, where banks might not want to lend them money or encourage them to set up businesses, but in these centres they can do that. And we know the detox programmes are vital for many taking that first step into recovery. We know methadone, we know its value, we know it can give stability in people's lives, but it's not a long-term solution except in very few cases, and there needs to be an exit strategy. So what I'm really stressing is the injection rooms are one part of a much bigger picture. And we know that addiction services were very, very badly hit during the recessionary budgets. I support the legislation as a harm reduction measure for chronic drug users, a controlled space for them to inject. But again, it's just one programme, and we can't lose sight of the other programmes and the other strategies that are part of the National Drug Strategy. In the rooms, we know that the addict will have access to clean, sterile injecting equipment. There will be trained staff, I'll go back to that, as well as who will be there in relation to the injecting, but also in relation if difficulties arise or if there's a danger of an overdose. So I have one question around the title, which is medically supervised, and what exact level of medical supervision will be available. Why would anybody support this? Well, it is in the hope of fewer deaths through heroin use and through overdose, because the alternative is to turn a blind eye to the public injecting. And the North Inner City has seen so many addicts injecting in lanes and on side streets, on the main streets, in doorways, on the Dart and the Lewis. And that's the reality. We know that these rooms have been working in Europe for 30 years. The first one opened back in 1986. We know the evidence for that the 90 or so drug consumption rooms around the world, evidence suggesting their effectiveness in reducing fatal overdoses, decreasing incidence of public injecting, and reducing drug-related litter. I know there are diverging opinions in Ireland, the fact sheets from the journal and from the library and research, and of course everybody, all sides will be able to present facts to support their argument. I'm not naive to think that it's all going to be plain sailing. But the point is made that we can't expect the rooms to prevent drug use or divert all users from risky use and solve the wider issues of dealing. There's no evidence that the rooms do recruit drug users into injecting. They're there for those who have been injecting long term. One thing I will say for this cohort of injecting room users, and I believe they need every encouragement, support, treatment into recovery. But the fact is that while they are injecting, they are deserving of our compassion and of dignity in that consumption, and I think the rooms will give them that. I know the relief it will give to their loved ones, because they're constantly waiting on that knock on the door to say that the addict has been found in a laneway or a doorway, needles all around them. For the consumption rooms to work and have a chance, location is important. They have to be easily accessible and the opening hours have to be flexible. And I know the concerns in Dublin around location. But when we look at these rooms in other cities, and when we look at addiction services in other cities, they don't attract the same attention that they are in Dublin. But it's vital that there is engagement with residents and also with the Gardaí. And it does come down to management and to staff. Two ironies. First of all, how cool it is, how trendy it is for a certain cohort of drug user to do their lines of cocaine in the nightclub or in the hotel. And that at the same time we see people who are injecting and the way in which they are looked down on. But it's the same drug dealer who is providing the drugs for both cohorts. And another irony is the way in which, we don't want them located near schools. But in the North Inner City, it's school children going to and from school every day who are watching people who are injecting. A couple of very short points. One is about the licence holder and the licence holder's responsibility. There's another concern around section 19(1)(e). That there's a need, I think, to amend there about the immediate personal consumption needing to be limited to small amounts of the drugs. The need to keep this under review as we go along. And also there's an element around insurance, because what's happening in the inner city at the moment, Dublin area, there's huge increases in insurance cover for the needle exchange programmes. The insurance has gone from €2,000 in 2016 and we're looking at nearly €15,000 now in some areas. Thank you.